knowing that nutraceutical supplements are a staple for many functional and integrative practices, as we've just pointed out, we also know that not all nutraceutical supplement companies are created equally. So what are some of the important questions the clinicians out there should be asking when choosing a supplement company for their practice? Like, is it materials? Is it regulations? What are the questions you think they should be asking of their supplement company?
Yeah, I mean, in this high-end physician channel that's exclusive to integrative medicine, there are a number of reputable companies, and for a doctor to be coming into this space, they need to understand that they should be working with a company that's committed to exclusivity to the channel, because to commit to being exclusive to the practitioner, there's a lot of areas where you can't cut corners. Raw material, raw material procurement is one of those. The country of origin, the purity, the standardization, there is an array of options in the marketplace. We can cut our costs down by 60, 70% on certain raw material categories by simply going overseas and doing a lot of what the over-the-counter direct-to-consumer, e-commerce niche does.
Right.
But we choose to remain committed to the practitioner channel and use only the studied raw materials that are found in the actual trials at the proper standardizations from countries of origin that are predominantly U.S., domestic, and European, where the studies were actually done on that said ingredient. Mm-hmm. And that results in clinically efficacious protocols, right? Because to get clinical outcomes, you need the right dosing and you need the right raw material to get there. And that's one of the first places you should be looking at, is a company that's definitely committed to exclusivity in the physician channel, that won't cut corners. The other area is going to be their quality assurance system. There's the FDA as their CGMPs, and they're very good at auditing companies in our channel, but you can go above and beyond what the FDA requires by getting third-party certifications. We actually have the NSF third-party certification, which is the most reputable third-party gold standard for GMP regulations. Mm-hmm. And that just goes to prove by an unbiased third-party audit that we are going above and beyond what is required, from an SOP standpoint in our manufacturing processes to a testing standpoint on our raw material and finished product side, because we're testing everything from heavy metals to microbiology to identity on every single lot coming in, and doing that again at the end, while having thousands of standard operating procedures, to actually arrive at a finished product, mm-hmm. which there's so many more economical ways, frankly, to get a supplement out the door. Right. But this is what it takes to be committed to the physician channel, where clinical outcomes are paramount to everything else. Yeah. So
that's so impressive. And I will say the other impressive thing about the fact of how exclusive you guys are from a quality perspective, then if you go and you start formulating on the website, the actual breadth of the number of ingredients you guys have available is almost surprising given the exclusivity, if that makes sense.
Yeah, exactly. When we started a decade ago, we had about 125 raw materials. Today we have, over 450 mm-hmm. and growing. And our biggest catalyst for bringing in raw material options are our physician users. Mm-hmm. They're constantly asking for new ingredients and, to express their clinical opinion in a custom or personalized nutraceutical format.
Yeah.
So, we built an online formulator that kind of takes the manual process out of that experience. Because if you can imagine making a personalized or a custom formula, is in a manual fashion is almost impossible. Mm-hmm. To get a quote, it takes weeks. And if you want to alter a dose, it takes more, double, triple that time. Mm-hmm. We built an automated software system that's all online and user-friendly that allows the practitioner to get instant serving size, instant pricing for the formula as they're building it. Real-time, every raw material's tap density is connected to our manufacturing line, real-time. Mm-hmm. So it's moving right into production, all based on the technology that's been built.
Yeah.